Good afternoon, everyone, to all the participants and the panelists, to the 7th chapter webinar of the NABH Education series for entry level. So today we have a very eminent speaker, Dr. Anuradha Pichumani, who is a gynecologist. She's a consultant she's also infertility specialist and a laparoscopic surgeon as well. She has she dons many hats. She also manages two hospitals in Tamil Nadu, one at Chengalpattu and another at Kanjipuram. She is a great quality champion. She has spearheaded CAHO in several international arenas. She is also the Joint Secretary of CAHO. She is also the member of the ISQA Person and Family Centered Advisory Council and the member of the ISQA Educational Advisory Committee as well. She is an NABH assessor herself, and she is also part of the IMA Tamil Nadu and Chengalpattu. She is also the faculty of ISQA Fellowship Program, and at the she also teaches at the Indraprastha University, New Delhi. She has a lot of awards and publications under her name, and I think it will take the entire webinar for us to read out the entire list of achievements she has had. Thank you, Madam, for joining us today. We have the ever-smiling Dr. Anuradha Pichumani today to speak about the chapter 7.
Good afternoon, everyone. It's going to be evening now, and thank you, Mr. Adel, for those kind words. Topic for today. So you have already listened to the various other chapters, the previous chapters starting from AAC, and now we are into the chapter of responsibilities of management. So as you all know, responsibility means accountability. So getting a person accountable is going to be really tough in these days. And that's how we have a separate chapter now given by NABH, which is the responsibility of management, of how organization has to be run, how the organization has to take care of the patients, hospital has to take care of the patient, the visitors who are coming into the hospital, and how it has to take care of its employees also. So this becomes the responsibility of the top leadership, and that is what we are going to see in this chapter, so that you improve on the quality and safety practices. So what I'll be doing in the next few minutes is, so I'll be able to tell you our my own experience in the last 30 years of running organization, of constructing hospitals, of managing staff, managing employees, taking leadership roles in various forums. So we'll just go through the standards, and if you have any queries, I'll try to address it at the end. Hope you find it more useful to take care in your own organizations also. So coming to the intent of ROM, you would have now realized that healthcare delivery is very complex. And again, more so during the COVID times, all of us found it very difficult to run our hospitals, be it small, medium, or large hospitals. We had to learn, relearn, and all of us have come out of all the problems. We were able to understand how to run organizations in the face of a pandemic. And that is because of having proper leaders in your organization. So always running organization is a dynamic process. You might need to understand what are the rules which are changing, and hence the leadership role is important. And so the intent of this chapter is to encourage the governance of the organization. So you need to have the top management person involved in everything, whatever the hospital is doing. So the person has to understand what is happening in the organization. It is not enough you have only the top leadership. For each and every department, you need to appoint a proper leader. So the leader has to understand the department, work as a team, so that every department improves and it's run in an ethical manner. So this has to be encouraged. So this is one of the top priorities of this chapter. And the other intent is on the patient safety and risk management issues. So you need to take care of your patients who are entering the organization, be it an OP patient or an inpatient. And the safety has to be an integral part of your patient care. not only the clinical care, the patient safety, be it fire safety or any other safety or infection control, everything has to be taken care of. And regarding the risk management, it has to be a proactive role. So the top leadership has to have a proactive role in finding out what are the risks in each department, and then take some action to prevent that risk from happening also. So this becomes the top priorities, and this is the main intent of this chapter. So when we want to know about the responsibility of management, you need to understand what is the leadership. So the leadership engagement and empowerment is very, very important. So the key factor in this clinical governance is the leadership is not only at the top, it has to be from the bottom upwards. So you have to involve every person in the organization, and you need to understand and create leaders within your own hospital. The people who are interested in quality, you need to create that type of leadership. So only with good leadership, you'll have a good culture in the organization. The safety culture will be permeated within the hospital, and the leader has to monitor and also train the staff and check repeatedly whether there is any error happening. And you need to deliver high quality care for in each and every department. And again, teamwork is very important. It is not the quality manager alone who's going to take care of the quality and safety. So you need to build and work with the team, and you have to empower your staff also. So that's why the training part is very, very important. So these are some of the qualities you need to look out for a good leadership. And again, when you are going to develop the leader has to understand the whole organization, and you need to improve that morality of the whole team. You need to recognize them, reward them, and then only you can keep your team motivated. So the leader will be the driving force to implement the quality culture within the organization. So it should not be a blame culture. It should be an open door policy. Any errors have to be reported so that you learn from each and every error and prevent it from happening again. So the role of a leader has to be defined, and it has to be developed. As you keep on working, you evolve to be a better leader. And this has to be quality driven. And to improve the quality, you need to have a vision and mission, which we will be seeing in subsequent slides. So this vision and mission is the main, which helps you to go on with your strategic planning. So whenever you talk about strategy is a long-term plan for 3 to 5 years. And then you have something called the operational plan. So strategy is a long-term vision, whereas the operational plan will be the plan which you're going to do the short term within 1 year. For the next year, you develop some operational plan, which you're going to discuss with your leaders. So whenever you're going to plan any strategy, you try to involve as many people, the stakeholders in the departments, and then you check the performance, what is the baseline, and then how you're going to improve the performance for each department. So it should be quality driven, and you will go through these chapter. This is a very small chapter. Though it is a small chapter, it is the most important one, because this management only drives each and everything in the implementation of your NABH standards in your hospital. So we have only 3 standards. ROM 1 talks about the organogram. We have 3 objective elements in the first standard. So organogram talks about the hierarchy in the organization, who is going to report to whom. And ROM 2 is the second standard. You have 4 objective elements, which talks about the ethical practices, which you need to follow. It is given by the Medical Council of India. So you need to follow the ethical practices within your organization. ROM 3 has 2 objective elements. It talks about the quality and patient safety. So moving on, ROM 1A is that every organization should have a documented organogram. So you have a general list of the departments, and then you create an organogram for your own hospital. Don't do a cut and paste from some other hospital, because it should be your own organogram for your hospital, so that each and every employee in your organization understands whom he has to report to. So this I'll show you some example of how to do an organogram. And again, ROM 1B talks about the registered. It has to be registered with the appropriate authorities. All the statutory guidelines have to be taken care of. You need to check all the licenses. Getting the licenses, getting these statutory things in place is the responsibility of the management. Again, ROM 1C, you need to have a designated individual who can oversee your quality and safety. You can have two separate personnel, one for quality and one for safety. If it is going to be a small organization, you can have the same person also. But the person who is given the responsibility for quality and safety, they have to be trained. They have to undergo some training. They have to understand whatever has to be done. They have to know how the organization is working. So they have to understand the departments. They have to have a good leadership quality, and then only they'll be able to perform better. So this is an example of an organogram. You can see it can be a trust hospital, a small private hospital with only two owners, a husband, a couple, or it can be a group of directors sitting on the board. So you have to have these the hierarchy written properly. Who are the doctors going to report to? It can be a medical superintendent. Who are the nurses who are going to report to? It can be a nursing supervisor or a nursing administrator. And you need to have some reporting personnel for your medical support services, your administrative services, your HR. Each and every department has to be taken care of in your organogram. You need to write this organogram only for the departments which you have in your hospital. And every employee has to be trained. They have to understand whom they have to report to. Moving on, we will see these are the mandatory licenses for a small hospital. So for any, you need to have your Clinical Establishment Act. CEA has to be in place, and you need to go according to your state guidelines. So each state, the licenses differ. So you have to register your hospital in your nursing home board or through your Indian Medical Association. And you need to have a license from your Pollution Control Board for handling biomedical waste. These are all mandatory for Air Act and Water Act. This consent is very important. You need to have, if you have the number of beds exceeding 10, then you need to have a STP installed in your hospital, sewage treatment plant. If you are running a pharmacy, you need to take care of your drug licenses, pharmacy licenses, your pharmacist licenses has to be in place. And if you're going to purchase and sell narcotics, then you need to have a narcotic license. If you have a radiotherapy, radiology unit, then you need to take care of your AERB licenses, blood bank license, or if you have a blood storage unit, you need to have those type of licenses. And PCP, NDT license, NPP license, if you're going to have your gynec departments, and also your transplant licenses if you are going to do a transplant. So you need to take care of all these mandatory licenses, which are very important. And again, you need to track these licenses. So it would be good if you have a tracker sheet, understand how to put a tracker sheet and give the responsibility of taking care of these licenses, because some of the licenses you might need to do the reapplication sometimes 3 months earlier, sometimes 6 months earlier. Even your NABH reaccreditation, recertification, everything has to be applied for. So you need to have someone who can track these licenses so that you don't forget to renew these licenses also. So this is very important. So we'll see how what is the role and responsibility of each person in this ROM chapter. So as soon as you put up your organogram, you have to have a person who is going to take care of your licenses, and also one staff who is going to update the license. It can be one person from your quality team. And these getting and reapplying for these licenses is very important. It has to be done on the given time limit. And again, you need to maintain proper records, have a legal tracker in place. And it will be better if you have a monthly update of whatever license is pending, which is coming up, which are the licenses which have to be renewed in the next month. So it will be good to have a license tracker. And it's not enough you have these licenses alone. Many a times you have various MOUs with other organizations, like for Pollution Control Board, you will have a MOU with your waste management person. So you might need to renew these MOUs also. So you need to have these trackers to renew all your MOUs. So sometimes you might have outsourced your laundry, you might have outsourced your security. So these MOUs have to be in place, have a proper form for getting these MOUs. The format has to be ensured that everything is written. What is the roles and responsibilities of your organization? What is the responsibility for the organization which you are taking as outsourced? And again, it will be better if you can have a quality check whether the organization is doing it properly. So because you will be accountable for anything and everything you're going to run in your hospital, because the patient is getting admitted based on your whatever you show him. So it will be better you maintain the quality of your outsource agency also. So you might need to have a person who has been appointed as a quality manager, and this designated person go individually to check the quality and safety in each and every department. But you might need to have a team who will take care of that specific department's quality and safety, and they will report to the quality manager. So you need to have a multidisciplinary team and form the various committees, which we'll be discussing later. So now we have talked about the organogram. So it is a documented hierarchy, the line of control, the roles and responsibility for each person in the hierarchy. And then so you are ensuring the transparency to all the stakeholders. You make everyone understand whom they are reporting to, and you define the functions and the responsibilities, and all these are incorporated into the various committees. And this organogram has to be documented in your Apex manual or the quality manual. And this for each and every organization, the legal requirements based on your state requirement has to be taken care of. And you have to display all these documents in a specific notice board in your own hospital. Moving on, we'll see what ROM2 is insisting. So this the organization is managed by leaders. So the leaders have to understand what is the what they have to take care of in ethics. It has to be very transparent, the way you're going to run your own organization. So for that, you need to understand what is a vision and a mission statement. So vision is something, which will be a long-term one. So what you're going to do in the future, what the organization is planning to do in the future, what it is going to change over to. So this is the vision of the person who has started the organization. So you're going to understand what you're going to hope for, what you're going to dream for. That is the vision. Whereas mission is what you're going to do today. So the direction of the whole organization will be given by the mission. So this vision and mission has to be understood so that the organization can go through. So you understand what the culture of the organization is going to take place for. So you have to understand this vision and mission and then make it public. So I'll give you some example of how to write a vision and a mission statement. And when you are going to write your vision and mission statement, it would be better you involve your stakeholders again, the board of directors, whoever are going to run the organization. And again, ROM2B talks about how you are going to do it in an ethical manner and how you are going to disclose the ownership. So you have to put a display of the ownership of the hospital, whether it's a private organization or it is a trust hospital. So whatever it is, you have to display it on the notice board so that the public can view it. ROM2D talks about the billing process. So this billing process is also should be accurate and it has to be ethical. You have to be transparent in the billing. So the treatment has to be uniform across every room, every patient. The various facilities can change based on the general ward or a private room, whereas the treatment has to be the same. So you have to be more transparent and very ethical when you're running your organization. So this is the way you have to write your mission statement. It refers to the overall purpose why the hospital is being run. So you have to, it will be good if you can have your mission statement again bilingually. As you would have seen in the first chapter, you have to put up all the boards which have to be understood with the patient in the local language along with in English also. So your mission statement can be put up in the website too. And your staff, every person working in the hospital should be aware of the hospital's mission. So only if they understand the mission statement, the team will start working towards a common goal. So the mission statement has to be strong so that every staff understands what they have to work for. So you are going to answer what the organization is going to accomplish. So it has to be understood with the patient stakeholders and the market also. And moving on to the vision, it is again an overarching statement. What will be the ideal state at a future point? How the organization wants to change itself, show itself in the community. So it has to be the vision of the head of the organization. So these two statements are important and both has to be understood by your staff. And the third part will be the values, for the value for which the organization stands for, the integrity, the compassion, the accountability, or the respect what you show. So all these come under the values. So the values are very important. And these ethical practices, the ethical practices can be based on the patient care, can be based on the staff, or it can be a general ethical practices. Related to patient care, you have to display the doctor's name, their registration number, your certificates. So all these are the qualification which the doctor has. All these have to be displayed so that the patient also understands. And so that you have to, and also you need to avoid unnecessary cross references. Only the cross-referral which are really essential has to be done. And all the clinical category, you can check with your committees. You can have some clinical audits in place so that you have a check on the patient care. And again, you can have some committees for the research also. So the research has to be done by an ethical committee. And for understand that tariff, it has to be uniform. It has to be a very transparent billing. You need to show the tariff to any patient who asks for it. So it can be a good practice to have a display of your tariff and to make the patient understand when they ask for it. The billing has to be transparent. So you need to give them a bill for each and every service you offer. And handling complaints is a very important part of patient care. You need to receive the feedback, and based on the feedback or based on the complaints, you need to improve your own organization. So this is a very important part of your ethical practice. And again, you have to ensure the staff recruitment is very smooth, very transparent. So you need to understand how many staff you're going to employ, what will be the performance appraisal. You need to make each and every staff understand the key responsible areas. That KPAs, KRAs has to be made, and you have to train each and every staff on that so that they understand and they start working towards improving their own KRAs, so that during the performance appraisal, they can have a good performance appraisal which has been done. And again, you might need to monitor your staff based on your satisfaction surveys, the way the patient is satisfied with your staff. So based on that, if you receive any complaint, you have to have a talk with that specific staff. So see what has happened. So these are things which are very important. And this ethical practice has to be in place. And this has to be taught to each and every leader in your hospital. And you have to avoid unethical marketing or any unethical advertising also. So the way you're going to do the transparency is you're going to display the ownership. So as you see in this picture, the ownership has to be displayed. Either it is a trust hospital or it's an individual owned hospital, the hospital registration number has to be displayed. There should be a uniform billing, and the same tariff should be given. You give a bill for each and every payment. So all these are some of the examples where you are more transparent in your governance. And moving on to the ROM 3. So ROM 3 has all these multidisciplinary committees. So the whole organization is the running all these committees is the most important thing. This first you need to, when you talk about committees, you need to understand there are certain committees which has to be done even in a small hospital. So these committees will be the quality and safety committee. The base mandatory committees are these 5 or 6 committees. The HAC committee, which is the hospital infection control, your pharmacy and therapeutic committee, your PTC committee. And if you're going to do blood transfusion or you have a blood bank or blood storage, then you need to have a blood transfusion committee, which will be reporting to the hemovigilance department. And again, you need to have a medical records committee. So these are the mandatory committees which you need to form. And when you talk about committees, you need to form these committees with the multidisciplinary team. So you need to involve the people who are working in those departments. It is not enough your chairperson is the only person who's working in these committees. You need to have people who are working in the medical records department. If you're going to form a medical record committee, you need to involve your nurses, you need to involve your doctors, because those are the people who are going to write those records, the people who are going to document it, who are going to do the documentation. So you need to involve your stakeholders in that committee. Then only whenever your committee meeting happens, they will be able to participate in that committee, and whatever corrections have to be done, they will go back and train their own employees so that the quality improves. So this is the way you have to find out ambassadors, your own quality ambassadors for each and every committee. And then you have to define the membership. You have to create the person who's going to chair each committee. For a small hospital, the same chairperson can be there for 2 or 3 committees also. But for a larger organization, more than 100 bed, 500 beds or 1000 bedded hospital, you will have multiple committees with each committee having a different chairperson. And for each committee, you have to define the roles and responsibilities for each committee, and you have to define the frequency which the committees have to meet. For it, you can define the frequency based on your own organization, but it will be a good practice to have it as a monthly meeting so that you have all these systems in place. And then as the culture develops, as it becomes ingrained, then maybe you can take it further as a quarterly committee or whatever it is, but you have to define the periodicity. And based on the periodicity, the meetings have to be run, and you have to write out the minutes of the meeting. So the documentation of each and every committee is very important. The meetings, what has been discussed in the meetings, who has attended the meeting, the agenda for each meeting has to be circulated before you come for the meeting, and then the minutes of meeting has to be recorded, and who will take the responsibility for each and every action plan. So, and again, it has to be reviewed. So the minutes of meeting of the previous meeting has to be reviewed, and then see if there is anything which has to be closed. If there is something which has not been closed, then it has to be brought to the notice of the top leadership. So that's why we ask the top leadership to review all the minutes of meeting at least quarterly, so that they also understand they participate in all these committees. So moving on. So we'll see how we are going to start these committees. You have to review all the areas of your hospital based on the various departments. You select the committees, you select the number of teams based on the size, the workload of the hospital, the feasibility. If it's going to be more than 100 beds, then you might need 2 ICNs, infection control nurses. You might need to involve your infection control officer, the doctors, the top management, all that. And then you have to review and approve the policy based on the scope. You might need to review a committee. You might need to write down what is the roles and responsibility for each and every committee too. And all these have to be documented in your Apex manual. So you plan the list of committees, you define the frequency and forum for the minimum people who have to attend the meeting, identify the chairperson, and then send out the invite. So send it as early as possible so that people are able to attend the meeting. Send an agenda and send it as an advance notice. Then when you're going to conduct the meeting, you discuss the minutes of the previous meeting. Any issue which has not been resolved, it has to be escalated to the top leadership and it has to be closed. And whenever you are introducing an agenda, you discuss the agenda and see whether the members are present. and who will be responsible for each and every decision. You have to assign the task, separate task, and also have a closure date for each and every task which has been assigned. Only if you have a date, it will be completed. So try to do it and then circulate it and see the top person has to check whether it has been completed before you come for the next meeting. And this minutes of meeting has to be signed by the chairperson. So you have to conduct this type of committee meeting. And as you run these committee meetings quite frequently, this helps you to run the hospital in a very efficient manner. So this is the Quality and Safety Committee. You are monitoring the key performance indicators in your quality and safety. So all the indicators which you are going to take care of, you have to collect the baseline data. The baseline data has to be collected by your frontline workers, your the persons who are working in the department, and then it has to be put in the specific the indicator, and then you have to check what is the baseline data, and then you fix up some goal. If it is at 80%, give them a probable target of 85% for the next quarter, and help the persons who are working in the department to achieve that goal. So tell them what is the action plan to improve on their indicators. So these things have to be discussed in this Quality and Safety Committee. Then you review the incidents which have happened in the last month, and then based on the incidents, you have to take some action plan. So you review all these incidents, review all the patient complaints, the feedbacks which they give. It is not only enough that you review the written feedback, you have to go and check your Google. Again, whatever feedback has been put in the Google also, the ratings which have the patients have given, see whether the ratings are becoming better, and you have a discussion with your team, and you have to have a safety committee which is being monitored. So any safety incident which has happened, so the safety always you take care, do a proactive risk management. So the NABH know the main standards and all talk about the risk registers, and it has moved on. So at least you need to have a safety committee in place, because fire accidents do happen in many of the organizations. So it is very important that the top leadership takes an active role in all these committees. And then you will have the Hospital Infection Control Committee, where you're going to talk about the hand hygiene audits, the complaints of the hand hygiene by your nurses, doctors, and other staff, the various needles, injury reports, the housekeeping effectiveness, the biomedical waste segregation, and all the theatre cleaning, linen management, everything. Your antibiotic surveillance management, everything has to be discussed in your Infection Control Committee. Moving on to PTC, the Pharmacy Therapeutic Committee will discuss about your formulary, any addition or deletion in your formulary, the various adverse drug reactions which has happened, which has to be reported to your Pharmacovigilance Committee. And again, the very local purchases, the any stockouts in your pharmacy, any new vendor selection, vendor re-evaluation. So all these stockouts have to be monitored to improve your pharmacy quality. In Blood Transfusion Committee, you will be talking about the usage of your blood components. It will be good if you can move on to 100% usage of blood components. Then check the licenses. Even in Pharmacy Committee, you need to have check on the licenses, whether they are they need to be reapplied and got back again. And you for in the Blood Transfusion Committee, you're going to check the wastage of your blood or blood components and any transfusion reaction. What is the action plan which has to be taken? And in the Medical Records Committee, you're going to review the medical records for any deficiencies. You have to do an audit. You have to do an audit of your missing records, the active records, and the discharge records. So check for completeness. And again, check all the mortality audits, the morbidity audits. All these have to be discussed in your Medical Records Committee. So these are the various committees, and all these things have to be documented in your Apex manual. And for successful implementation of all this, so again, we talk about the top leadership. So the leadership involvement is the most important thing. Only if the leader gets involved, the quality and safety practice starts permeating into the hospital, into each and every department, and you ask them to take the ownership for patient safety. And each and every leader has to be accountable. And you try involving your patients also in the patient safety practices. You have to train your employees. Training and retraining is very, very important. After training, you have to do the audits, see what is the quality improvement in place. It has to be a total quality management. A continuous quality improvement initiative has to be done, and each and every staff has to be involved in some audit or other. And you can start using quality tools, and only with rewards and recognition, you can keep your team motivated, and then you'll be able to have a successful implementation of your NABH standards. So in this way, you'll be able to achieve the ROM standards, whatever has been given. I'll be happy to take up any questions now.
What is the role of a manager in implementing ethical practices?
Yeah, so this is a very good question, and because the role of a manager, it can be a quality manager, it can be the most important person in the hospital. The top leadership has to be involved in these ethical practices. If you go through your ethical practice, which has been given by your Medical Council of India, they tell you what are the standards which you need to practice. It can be about the transparency in billing. It can be the way you're going to take care of your employees, the recruitment of your employees, all these things. So every department person will be important in maintaining this ethics. So you need to write down these practices, train your leaders in implementing them, and then every leader has to understand what they have to follow. So the culture has to be the culture has to be into the organization, so in each and every department. So the manager has to involve all the leaders specifically when you are going to understand the ethical practice. Yeah, Meenakshi. And again, someone has to check the implementation. It is not enough you have a written ethical practice. So based on the feedback from your patients, feedback from the other doctors, from your consultants, you will be able to understand whether it has been implemented in place, whether the implementation is happening. So this is also very important. So based on the, if there is some negative feedback, you have to sit and talk to the department, do the retraining, and then go on. So checking whether the implementation of these ethical practices are happening, like I was telling you about the recruitment and doing the appraisal for staff. Based on your staff feedback, you will be able to understand whether these ethical practices are in place. So that is a good way of monitoring it also. Yes, Meenakshi.
Yes, ma'am. Thank you. The next question is: organogram should have only the positions of the staff, or the names of each member also should be available?
Yeah, it will be easier if that department person understands the name. Sometimes the people do change. So in the organogram, it's enough if you can put the position alone, because because of attrition, sometimes some of the names can be changed also. But the individual department person has to understand whom he has to report to. Okay?
Yes, ma'am.
Yeah.
The next question is, do we need to have a strategic plan for entry level also?
Entry level, as of now, they have not asked you to do the strategic plan and the operational plan. But to run your organization, you need to understand what you have to do for the next 3 years, next 1 year. So this is very important because it's very competitive now, and to run a very ethical organization, you need to work on all these things. So you need to understand the strategy of how you're going to run the organization. So only if you have some short-term plan, you don't need to call it as a strategy also. It can be called as a short-term plan and a long-term plan. So only if you sit and start planning, you will understand what is the budgetary requirement. Then only you will be able to allocate budgets for improvement of your HIC department, or for your infection control practices, or your fire safety practices. And that will all come under your short-term planning. Your long-term planning will be some improvement on your services. You are going to include oncology. You are going to expand your hospital, or you are going to improve on your infrastructure. All these things are very important. So this comes under your strategy plan. If you are able to do that, it will be very good for you to run and do the administration in a efficient manner. Yes, Meenakshi.
The next question is, what is the difference between QIP and clinical audit?
So quality improvement projects are, you take up some project and see how you can move from this number to the next number. So it will be a continuous cycle. So you have multiple cycles. You follow your PDSA cycle, the plan to study and act. So multiple PDSA cycle forms your quality improvement project. So you don't need to show some improvement from 50% to 100%. You can show a step-by-step implementation that is called a quality improvement cycle. So like from 50%, it would have moved on to 55%. You have to define the time and the target. So like if you are having a hand hygiene compliance, you're going to check the quality improvement. You are going to take it as a quality improvement project. So if you want to improve the quality improvement hand hygiene compliance of your nurses from 50 to 80%. So you first take as one cycle as 50 to 60%. Put out some actions which you have to take to improve it from 50 to 60. Might be you might need to train your employees, or you might need to improve on your resources, or you might need to keep on reminding them, do some reminders. So based on these action plan, you will be able to show some improvement. So that becomes your quality improvement project. Whereas clinical audits, you take up some topic based on the feedback you have received, or something you want to improve in your own organization, or there is some incident which has happened. So you want to check whether you will be able to improve that specific thing. So based on that, you are going to do a clinical audit. So when you go through multiple cycles, it becomes a quality improvement project. Yes, Meenakshi.
Yeah, ma'am, the next is, what is the role of a managing director, deputy, and CEO of the organization? I think this is a very hospital-specific question, ma'am.
Yeah, it becomes you need to define the roles and responsibilities based on the people you have employed. So it is the top leadership's role to define the individual responsibilities. So because each and every organization is different. So every organization will not have managing director, deputy director, or COO for each organization. Some hospitals have a managing director, some hospitals will have a COO. So based on your individual needs, you define the roles and responsibilities, and see which is required for your own organization. So if it's going to be operations alone, you can have a chief operating officer. The more of your day-to-day operations can be taken care of by that person. The overall reporting will be your managing director. If you need a person to if you need an assistant to your managing director, then you can have more number of people working under the managing director. So it is your own way. You define the organogram, define the number of people who you have work in your hospital, and then you define the roles and responsibilities. Sometimes you might need to add on some roles and responsibilities, and based on that year's specific need, you might need to remove some responsibilities also. Hope you have understood. Yes, Meenakshi?
Yes, ma'am. The next question is, do we need to have the names of the committee also added in the organogram, and what is the tenure of membership for a committee?
So you don't need to write the committees in the organogram. Organogram is enough if you if it can be made to, if you can make your staff understand whom they have to report to. It is a reporting hierarchy structure. That's it. Your committees have to come under your in the quality manual. You have to document all these committees, and for each committee, you need to define who will be there in the committee. It will be a good practice if you have more number of people get involved in these committees. The more number of people, if they are involved, then it will be more easier for you to do your individual audits. So like in our hospital, we have various nurses who are auditors. We have many people doing small audits within the records. So if it's going to be a record audit, We ask one nurse to check all the concerns, one nurse to check all the whether the SSI your HIC practices are in place. So individually, each and every nurse is doing one audit or the other. So if you start involving your whole team, that will be good. And you can define the tenure of these people who are going to be the members in the committees also. It will be good if you can have it at least for 1 year. And based on the size of the organization, if you are increasing the scope, if you are increasing the number of beds, you can add on the committee members also. It is not a hard and fast rule. You can add on the members, and it will be good if you can take it up at least for 1 year, the same members of the committee, so that they'll be able to show some improvement. Yes, Meenakshi.
Yes, ma'am. So I think we're done with the questions almost now. Thank you, ma'am. I think it was really a wonderful session.